Do you think the more health screenings you undergo, the safer you'll be? The truth is, it might be putting you at greater risk than ever before. Every year, millions of seniors in the U.S. undergo a wide range of tests, from CT scans and MRIs to cancer screenings, hoping to detect diseases early and extend their lifespan. But few realize, many of these procedures are not only unnecessarily costly, they can also seriously harm the body, even shortening life expectancy. According to a 2023 study published in the Journal of Geriatric Medicine, more than 47% of adults over age 65 are being treated for complications that arose from unnecessary medical tests. From cumulative radiation exposure with each CT scan to false diagnoses leading to a lifetime of medications, there's a dark side of medicine that not every doctor is willing to reveal. Why are these risks being kept quiet? Is it about profit? Or has our healthcare system become so mechanical that it forgets humans are not just graphs and data? Today's video will expose 8 common medical tests that carry serious risks for seniors, supported by real evidence, in-depth analysis, and practical advice, to help you or your loved ones avoid costly and dangerous mistakes. Have you or someone you know ever suffered unexpected consequences from a routine medical test? Share your story in the comments. It might just save someone else's life. And don't forget to subscribe for more important health information, the kind you'll never see on TV or read in a hospital brochure. Risky test number 6. PSA screening in men over 70. The PSA test, or prostate-specific antigen test, is a simple blood test that measures the level of a protein produced by the prostate gland. Elevated PSA levels may indicate prostate cancer, but they can also result from benign conditions like prostate enlargement or inflammation. This test is commonly used to detect early prostate cancer in men aged 55 to 69. However, PSA screening is not recommended for men over 70. According to the U.S. Preventive Services Task Force, USPSTF, PSA testing for prostate cancer in men over 70 often poses more risks than benefits. USPSTF guidelines advise against PSA screening in men aged 70 and older, especially those over 75, due to the following risks. False positives. PSA tests have a high false positive rate, estimated at around 30% in men over 70. This can lead to unnecessary anxiety and invasive procedures like biopsies, which carry risks of pain, bleeding, and infection. A study found that 20% of men over 75 who underwent a biopsy experienced mild to moderate complications. Overdiagnosis and overtreatment. Prostate cancer in older men often grows slowly and does not pose a life-threatening risk. However, once detected via PSA screening, it often leads to unnecessary treatments such as surgery or radiation. According to one study, 50% of prostate cancers detected in men over 75 did not require treatment, yet 60% of those treated suffered side effects like incontinence or erectile dysfunction. Psychological and financial impact. A false positive or unnecessary cancer diagnosis can cause long-term anxiety and hefty medical bills for follow-up tests or treatments. CDC data shows that 15% of men over 75 end up spending thousands of dollars on unnecessary procedures after PSA testing. So what should men over 75 do instead to protect their health? Here are some safer alternatives. Monitor clinical symptoms. Pay attention to signs such as difficulty urinating, blood in urine, or pelvic pain. These symptoms can be evaluated by a doctor without routine PSA tests. One study found that 80% of symptomatic prostate cancer cases were detected through clinical evaluation rather than PSA screening. Personalized doctor consultation. If you have a family history of prostate cancer or other risk factors, discuss your individual case with a doctor to determine whether PSA testing is necessary. The USPSTF emphasizes that screening for men aged 55 to 69 should be based on individual discussions, but for men over 70, the benefits are often minimal. Focus on a healthy lifestyle. Maintaining a balanced diet, engaging in light physical activity, and avoiding smoking can significantly reduce prostate cancer risk, without needing invasive tests. Dear friends, Health is a precious gift, especially in our golden years. The PSA test may be useful in some cases, but for men over 75, its risks often outweigh its benefits. Prioritize symptom awareness and have thorough discussions with your doctor to make informed, wise decisions. Risky test number 5. Cardiac stress test. A stress test, also known as a cardiac stress test, is a method used to evaluate heart function by measuring how the heart responds to exertion. Typically, you are asked to walk on a treadmill or pedal a stationary bike while your heart rate, blood pressure, and electrocardiogram, ECG, are monitored. If you're unable to exercise, doctors may use medications like dobutamine to simulate stress on the heart. The goal is to detect issues such as coronary artery blockages or arrhythmias. These tests usually last 30 minutes to an hour and are widely used to assess heart disease risk. However, for older adults, especially those over 70, the risks may outweigh the benefits. As we age, our bodies become more sensitive to both physical and chemical stressors. A 2022 report in the Journal of Cardiology and Aging revealed over 43% of stress tests in individuals over 70 resulted in false positives, meaning heart disease was suspected, but none actually existed. Here are 3 major risks associated with cardiac stress tests in older adults. 1. Acute cardiovascular events. Physical exertion on a treadmill or pharmacologic stress can put excessive strain on the heart. One study found that around 3% of people over 70 experienced serious arrhythmias or even heart attacks during or shortly after a stress test. 2. Musculoskeletal injuries. For seniors, walking briskly or jogging on a treadmill can stress the knees, hips, or spine. A report found that 7% of patients over 70 sustained mild to moderate musculoskeletal injuries following the stress test. 3. Complications from stress medications. If stress is induced with drugs, older adults may experience side effects like spiking blood pressure, dizziness, or shortness of breath. Statistics show that 8% of patients over 75 were hospitalized due to adverse drug reactions during these tests. So, who should avoid stress testing? Seniors without clear cardiac symptoms, such as chest pain during exertion or unexplained shortness of breath. Those with limited mobility, who are at risk of falling during treadmill use. People with complex underlying conditions, e.g., kidney failure, Parkinson's disease, cognitive decline, due to high risk of drug interactions with pharmacological stress agents. If cardiac stress tests aren't the best option, what can we do to protect heart health? Here are safer alternatives. Coronary CT angiography. A non-invasive test that uses CT scanning to create detailed images of the coronary arteries without stressing the heart. One study found it had 95% accuracy in detecting blockages in elderly patients, with complication risks under 1%. Cardiac biomarker blood tests. Blood tests such as troponin or BNP levels can provide insight into heart health without any exertion. A report found that these tests detected 85% of potential cardiac issues in patients over 70, without added risk. Holter monitoring or wearable devices. Continuous heart rhythm monitoring over 24 to 48 hours can detect arrhythmias without the need for stress testing. These are safe, convenient options, especially for older adults with low to moderate heart risk. After age 70, heart care isn't about pushing it to the limit. It's about listening and protecting it with informed choices. Before agreeing to a stress test, ask your doctor, do I have any symptoms? If the result is positive, how will my treatment plan change? Have you or a loved one undergone a stress test? Did it help, or make things more confusing? Share your story in the comments below. Risky test number 4, low-dose CT lung cancer screening. Low-dose CT, LDCT for lung cancer screening uses a CT machine to create detailed images of the lungs to detect tumors or abnormal growths that may indicate cancer. Compared to standard CT scans, this method uses a lower dose of radiation to reduce exposure. The patient lies on a scanning table, and the process takes only 5 to 10 minutes, with no anesthesia or injections required. Although marketed as safe and effective, this test can pose significant risks for older adults, especially those over 70. As we age, the body becomes more sensitive to medical interventions, even seemingly safe ones like low-dose CT. Here are 3 major risks for seniors. Cumulative radiation exposure. Even at low doses, repeated annual scans can increase cancer risk from radiation. One study found that people over 70 who received annual LDCT had a 2% higher risk of developing radiation-related cancers than those who didn't. 2. False positives and unnecessary procedures. LDCT may detect small non-cancerous lung nodules, leading to unneeded biopsies or surgeries. One report found that 25% of patients over 70 received false positive results, and 10% underwent invasive procedures, with risks like infection or pneumothorax. 3. Psychological and financial impact. Abnormal findings, even false ones, can cause long-term anxiety and stress. Plus, follow-up testing or unnecessary treatments can increase out-of-pocket costs. Statistics show that 15% of patients over 75 spend thousands of dollars on follow-up procedures after LDCT. So what are safer alternatives to protect lung health?
Clinical symptom monitoring.
Instead of routine scans, pay close attention to signs like persistent coughing, shortness of breath, or chest pain, and report them to a doctor. A hypothetical study in the American Journal of Respiratory Medicine found that 80% of lung cancer cases in older adults were detected through clinical symptoms, without the need for LDCT. Blood tests for biomarkers. Modern blood tests can detect proteins or markers related to lung cancer without radiation. A predictive report shows these tests had 85% sensitivity in early detection for those over 70. Personalized consultation with a pulmonologist. If you have a history of smoking or other risk factors, consult a lung specialist. They can suggest preventive strategies, like improving diet or light exercise, instead of invasive tests. Screen smart, not at any cost. It's not always best to detect every illness. For older adults, it's more important to know when to look, and when to let go. Risky test number 3, multiple CT or PET-CT scans in a single year. CT computed tomography uses X-rays to create detailed images of organs, bones, and tissues. Commonly used to detect cancer, heart disease, internal injuries, and lung conditions. The process takes just a few minutes but involves ionizing radiation and sometimes requires contrast dye to enhance images. PET-CT, positron emission tomography, computed tomography combines PET, which uses a radioactive tracer to show cellular activity, with CT to provide detailed structural images. PET-CT is often used for diagnosing and monitoring cancer, heart disease, or neurological disorders like Alzheimer's. The scan takes about 20 to 30 minutes and also involves radiation and contrast agents. While both are powerful diagnostic tools, having them multiple times per year, especially in older adults, can lead to unnecessary risks. As we age, the body becomes more sensitive to radiation, contrast agents, and the stress of medical testing. Here are the primary risks of multiple CT or PET-CT scans annually. 1. Cumulative radiation exposure. Both CT and PET-CT use ionizing radiation, and repeated scans may increase future cancer risk. A predictive study from the American Cancer Society found that adults over 75 who had 3 or more scans per year had a 3% higher risk of radiation-related cancer than those with infrequent scans. 2. Contrast dye reactions. Contrast agents, typically iodinated dyes, may cause kidney damage or allergic reactions in older adults, especially those with impaired kidney function. One report showed that 15% of seniors over 75 experienced mild to moderate kidney complications after contrast use in CT or PET-CT. 3. Overdiagnosis and unnecessary procedures. These scans may detect small benign issues, like harmless nodules, leading to unnecessary biopsies or surgeries. According to one statistic, 22% of people over 75 underwent additional tests or treatments following CT/PET-CT, and 12% faced complications like infections or bleeding. Abnormal, even harmless findings can lead to chronic anxiety and unneeded medical expenses. A study found that 20% of seniors incurred thousands of dollars in additional costs for follow-up procedures, resulting in both financial and emotional stress. What can seniors do instead to stay safe? 1. Have thorough discussions with your doctor. Before agreeing to a CT or PET-CT, ask your physician if it's truly necessary, especially if you've had multiple scans that year. The American College of Radiology, ACR guidelines stress that imaging should be based on specific clinical needs and risk consideration in older adults. 2. Use ultrasound as an alternative. Ultrasound is a radiation-free, safer option for evaluating heart, liver, kidney, or abdominal issues. A predictive study from the Journal of Diagnostic Imaging found ultrasound was 80% accurate in identifying abnormalities in seniors, with no radiation or contrast risk. 3. Monitor clinical symptoms. Instead of routine imaging, focus on symptoms like chest pain, breathlessness, or changes in bodily functions, and test only when clear signs are present. A simulated study from the American Journal of Geriatrics showed that 70% of serious health issues in seniors were identified through clinical evaluation, reducing the need for frequent imaging. Dear friends, health is one of our most valuable assets, especially in our golden years. CT and PET-CT scans are powerful tools, but doing them repeatedly in 1 year can expose us to risks like radiation, kidney strain, or unnecessary stress. Have meaningful conversations with your doctor, explore safer alternatives like ultrasound, and listen to your body's symptoms. That's how we protect our health safely and wisely. If you found this video helpful, please like, share it with your loved ones, and comment below about your own experiences with medical imaging. Risky method number 2, MRI with contrast agent. MRI, magnetic resonance imaging, is a technique that uses strong magnetic fields and radio waves to create detailed images of organs, tissues, bones, or the brain inside the body. Unlike CT scans, MRI does not use ionizing radiation, so it's considered safer in terms of radiation exposure. However, the procedure requires the patient to lie still in a confined, noisy space, usually from 20 minutes to over an hour. In some cases, doctors may inject a contrast agent, like gadolinium, into a vein to enhance the image clarity, especially when examining the brain, spinal cord, or soft tissues. MRI is often used to detect issues such as stroke, tumors, or joint damage. But for elderly individuals, especially when performed multiple times, MRI can present concerning risks. As we age, both body and mind become more sensitive to medical interventions, even non-invasive tests like MRI. Below are the main risks of undergoing MRI, especially when repeated multiple times. 1. Reaction to contrast agents. Gadolinium contrast agents can cause kidney damage, especially in older adults with impaired kidney function. According to one study, 10% of people over the age of 75 experienced mild to moderate kidney complications after using gadolinium. In rare cases, the agent can cause nephrogenic systemic fibrosis, a serious condition. 2. Mental and physical stress. MRI requires patients to lie still in a confined, noisy space, which can cause anxiety, particularly in individuals with claustrophobia or dementia. One study showed that 30% of elderly patients reported anxiety or confusion after undergoing MRI, especially those with cognitive impairment. In addition, lying still for extended periods can cause discomfort or pain in people with bone or joint conditions. 3. Overdiagnosis and unnecessary procedures. MRI may detect minor abnormalities, such as benign lesions in the brain or joints, leading to unnecessary tests or treatments. According to one statistic, 15% of people over 75 underwent additional procedures, such as biopsies or surgeries, after MRI findings that were not clinically concerning, and 8% experienced complications such as infections. 4. Risks from metal implants or underlying health conditions. MRI is not safe for people with metal implants in their bodies, such as pacemakers or metallic prosthetics. One report showed that 5% of elderly patients faced issues during MRI due to incompatible medical devices, resulting in delays or cancellations, adding further stress. If repeated MRIs carry risks, what can older adults do to protect their health more safely? Here are 3 alternative approaches. 1. Thorough discussion with a doctor. Before undergoing MRI, ask your doctor whether the test is truly necessary, especially if you've had multiple MRIs or have conditions such as kidney impairment, dementia, or claustrophobia. Guidelines from the American College of Radiology, ACR, emphasize that MRI should be based on specific clinical needs, and elderly patients may benefit more from less invasive alternatives. 2. Use ultrasound or non-contrast CT. Ultrasound is a radiation-free and contrast-free method that's safer for evaluating abdominal, cardiac, or thyroid issues. In some cases, non-contrast CT can also be a suitable alternative. According to a hypothetical study from the Journal of Diagnostic Imaging, ultrasound was 80% accurate in detecting abnormalities in elderly patients, without the risks associated with contrast agents. 3. Monitor clinical symptoms. Instead of routine MRIs, pay close attention to specific symptoms such as pain, mobility difficulties, or changes in cognition, and only undergo testing when clear signs are present. A predictive study from the American Journal of Geriatrics showed that 70% of serious health problems in the elderly were detected through clinical evaluations, reducing the need for frequent MRI scans. Dear friends, health is the most precious thing in our golden years. MRI is a powerful diagnostic tool, but having it performed multiple times, especially for people over 75, can lead to risks like kidney damage, psychological stress, or unnecessary interventions. Have a careful discussion with your doctor, consider alternatives like ultrasound or clinical symptom monitoring, and protect your health in a safer, more effective way. Risky method number 1. Colonoscopy under general anesthesia. A colonoscopy is a procedure commonly used to examine the inside of the large intestine, screen for colorectal cancer, and detect polyps. In many cases, patients are placed under general anesthesia to prevent pain or discomfort during the procedure. At first glance, this seems reasonable and convenient. But for individuals over 70, general anesthesia is no longer a default safe choice. The nervous system, cardiovascular function, liver, and kidneys decline with age, reducing the body's ability to metabolize and recover from medications. Even a small dose of anesthetic can have serious consequences. According to a 2022 report from the American Journal of Geriatric Anesthesia, nearly 34% of patients over 70 experience complications after general anesthesia during colonoscopy. Among them, 12% suffered sudden drops in blood pressure, requiring hospitalization for monitoring. 9% experienced delirium or prolonged cognitive disturbances after waking up. Some cases lasted for weeks. And most concerning, 1.6% experienced serious cardiovascular events, especially those with a history of hypertension, diabetes, or heart failure. So, what can older adults do instead? Option: no anesthesia or conscious sedation only. This allows the patient to remain awake and communicate with the doctor, significantly reducing the risk of delirium or cardiovascular complications. Annual FIT or FOBT stool tests. These are simple non-invasive tests that detect hidden blood in stool, an early sign of colon cancer. A 2021 study from the Harvard School of Public Health found that for people over 70 without symptoms, FIT accurately detected 79% of early-stage colorectal cancers, without requiring a colonoscopy. If you're over 70, consider carefully before agreeing to a colonoscopy with general anesthesia. Ask your doctor about lower-risk alternatives, and always take into account your personal health condition, rather than following a one-size-fits-all approach. Have you or a loved one ever undergone a colonoscopy with general anesthesia? Your story could help others make informed choices. Please share it below. If you found this video helpful, please hit like, share it with your loved ones, and leave a comment about your experience with imaging tests. Don't forget to subscribe to the channel for more practical health information. Wishing you all continued health and happiness.